record to check. Okay. Yes.
Recording in progress.
Are we live?
Thumbs up for live.
Trying.
We're working on it. It takes a sec. But we are recording.
Yeah.
Yes, we can't streaming to Access Europe because we haven't permissions to publish in this group. I don't know why. But...
Okay.
So,
We can stream to Czech Republic at least, or
We can just record it too and post it after. More fun. It's more fun live though. Thanks for your patience, everyone. We had technical difficulties. I don't know anything about the streaming live really, so you know, could we stream live to my page?
yeah, we are go to live to the Access Consciousness Czech Republic.
Okay, we are live.
Yeah.
okay. So, hello everybody, vítejte všichni. Today we have a Glenna Rice here, Dr. Glenna Rice from US. Dneska tady máme doktorku Glennu Rice z Ameriky, and we will talk about her specialty class, specialty technique called EMT, Energetic Manual Therapy. Dneska budeme mluvit o Glenině speciální třídě, která se jmenuje Energetická manuální terapie, EMT. So, because Glenna is coming to Europe soon, Glenna bude brzy v Evropě, and she will have several classes, but I mít několik tříd. One in Prague in November, jednu hnedka v listopadu v Praze, and then several classes after Christmas in Poland and Germany, v Polsku a v Německu. And what, anything else, Glenna?
I'm going to Buenos Aires after the Germany class.
A pak Buenos Aires.
February, yes.
So, welcome, Glenna. Vítej, Glenno. Maybe first you can introduce yourself.
Yes, I'd be happy to. So thanks for setting this up, Vendela. It's wonderful. And for anyone listening live, there is Zoom. This is a live Zoom, and there are languages translated. And I don't know if we can get those links into, if they can find them easily to get on the Zoom if they're just listening on Facebook.
Mm-hmm. My jsme tady naživo na Zoomu a ještě to streamujeme do České republiky, do Access. A pokud se chcete připojit k Zoomu přímo, tak je to taky možný. Já myslím, že Pavel tam dá asi někam linky. Já ještě budu překládat český Zoom, takže já se za chvíli tady vypnu mikrofon. I just say that I will need to switch off my microphone soon because I'm translating to other Zoom. And if anybody wants to join, they can find the links anywhere. Pavel will take care of it.
Okay.
So,
fabulous.
Yeah, we will be happy to hear about EMT. Rádi uslyšíme o EMT. And
then you're going to go into translation, and the Zoom will be in English.
Yeah. So,
okay.
Takže ten Zoom bude v angličtině a pokud někdo se chcete připojit, bude i česká nahrávka s českým překladem, kterou můžu poslat později, budu posílat později. Pokud o ní máte zájem, tak mi napište, nebo Pavlovi, nebo Radce. A pokud se chcete připojit k českému Zoomu teď živě, tak je to možný prostě mít živý překlad ještě ke Gleně. So I switch
and we will make sure that people are muted. Okay, so welcome everyone to a talk about EMT. Energetic Manual Therapy, a specialty class that I do, an Access Consciousness specialty class that I have put together or developed, created, however you want to say, from my years of working with Access and being an Access facilitator, an Access body class facilitator, and being a physiotherapist, physical therapist in America, we call us, and my doctorate in physical therapy. So working on thousands of bodies over the years, using the Access tools of being a question with bodies, talking with the body, listening to the body, asking the body questions about what it knows, along with this hands-on manual therapy work that I had been doing before I found Access, that then morphed into this completely different thing once the Access tools were added to it. But the body work is targeting the body's fascial system, the connective tissue of the body. But it's way bigger than that, because your whole body is connective tissue. You have connective tissue from your heads to your toes, around everything, extracellular, intracellular, around, surrounds, connects, keeps your body, gives it shape, and it gives it form. And it's a really amazing organ, the fascial system. It's a shapeshifter. It changes, it transforms, it's transformative. And with this work, with the questions we have with Access being a question and putting tension into the system with the hands-on manual therapy, you can create extraordinary changes, amazing results with things that seem unchangeable with bodies. So excuse me, I was doing this for quite a few years. I'd be in the back room in an Access class doing my thing. And people would be asking me, what is this? Can you teach this class? People would get sessions. I really want to learn this. Can I teach it? Can you teach it? Can you teach me? And it took me quite a few years. So my first Access classes were like almost 20 years ago, 18 years ago. And it took me a while, probably 10 years or more, to finally go, okay, I'll do this. And for a while I taught the SE for Bodies class, very similar to what this class is now. Now that class has grown and expanded and created itself with Susie Godsey teaching all of that. She's the founder of that class of SE. But that was kind of a beginning of this class, teaching it, giving people these tools. And since just pre-pandemic, like a year or so before, I started teaching it around the planet. And then we got locked down for a couple of years, and I'm back in action, and I have classes up all over the world, which I'm really, really excited, because it's been growing in a way that has amazed me. And the feedback I've been getting from people that have taken the class and done the body work has been incredible. So I would love questions. Like, what do you guys want to know? I know a lot of people on here, some of my translators have all taken the class, sometimes multiple times with me. If you guys have anything you'd like to share about what you have received from the class, what you're looking forward to the class that's coming up. And this whole Zoom was started because there's a class coming up in Prague soon, in 4 weeks, end of November, just right after American Thanksgiving. And so my team in Prague was like, let's get a Zoom out. And then this exploded into 4 other languages. And what do you guys want to know? What would you guys like me to talk about? Does anyone have any questions? Not, I can just chat. So how do we work with the fascia? What is fascia? It's connective tissue. It's you guys have all seen it. Like if you had a chicken breast and you pulled it up and there's that white stuff you see, it can be very loose, spongy like material, or very, very strong in your connective, your ligaments and tendons that connect your body together. But your body, your organs, and all the tissues in your body that are not fascia are suspended and float. There is a question that came in, but I can't read it. Suspended and float in this system. And the system can tighten down and contract and get tighter over time with points of views. Let me say that again. Your points of views can solidify this tissue, which solidifies the whole body. And you'll see people, as you know, people get into their older years, they kind of shrink down, their head goes up, and they can't move around as much. A lot of that can be the fascial system. Now the tissue is so, okay, someone just asked that question. What's the difference between EMT and SE? The facilitators are different. I worked with Susie for quite a few years with the SE classes. I was facilitated with her with the extravaganzas and the SE for Bodies. She was teaching horses and I was teaching the body class. And then she started teaching the body class again after a few years hiatus and has grown with that. I have unfortunately not been to her class since she started teaching it on, and she changed the manual and has created what she's doing. So I can't speak to what it is now. I know she's amazing. I would say go to both classes, We have different backgrounds and very similar backgrounds. I mean, it was the access tools that created these classes. The energy of the body work that's being done and what you get from the classes came from this amazing work of being a question, asking questions, being you, knowing what you know and knowing what the body knows, asking what the body knows. So there's a lot of similarities in that. We have that similar background. We started Access around the same time. So we've been doing it a long time. She's the animal lady too, so she brings all of that. And both of these works can be done on any body that's not you can't be done on plants, but it can be done on your cats, your dogs, your pets, your horses, obviously, with Susie's been working on horses with this forever. And I've even worked on a hamster, so it can be done on any body. There was another question that just came in. I saw it, it's not in English. So the one thing about asking the difference, which I know people are curious, they've been to maybe an essay class or they've been to classes with me and they want to know what they're going to get out of it. When you're asking for a difference, you're looking for something to judge, to compare. And so I really it's not that fun for me to talk about it that way because they're both fabulous. I mean, I love my class that I'm teaching. I've been creating amazing things on the planet. And I know that the SE is also creating that. So it's just what's your body drawn to? And if you could do both, do it. And if you could do anything with Susie, I'd say get yourself to an extravaganza class because that's where her magic is, like, because you get to work on horses and people at the same time. So what is this other question that just came in?
Okay. Yeah, I can translate.
Oh, there it is. It's translated. Thank you, Pavel. What can EMT bring to people? Okay, I'll read it in English. What can EMT bring to people with musculoskeletal pain and people who are well? What about EMT and children? What about children on EMT? Okay, are there any EMT courses for children? Well, children are invited to all access classes and they're for free. If they're under 16, they're free. 15 and under, 16 to 18 is half price. They do come to my classes. When I first started doing fascia work, myofascial release is what I was calling it then. My son, I think he was 6 or 7, and he was one of the best therapists I had. When I taught him how to do some of this stuff with me, and he was excellent. It's something anybody can do. You do not need a background in any kind of a medical profession or body work or anything like that. The tools or the techniques that I show you are giving you a really basic fundamentals of how to do this body work. And it doesn't require any kind of special skills except, hands are nice. Because it's hands-on, because you're touching bodies. So that's the main prerequisite for this class is that you have a body. And any age babies can come to the class. They're probably not going to be doing it, but they might receive the work. And because I also teach the parenting classes in Access, Conscious Parents, Conscious Kids are always welcome in my class, and I love what they add to classes. So what was it? There was more to that question. What can EMT bring to people with musculoskeletal pain? Well, pain's a really interesting thing, isn't it? So what is pain? And we will talk about this, and it is a big part of the conversations in this class and the clearings we do with pain, because pain is information your body is giving you. It's not necessarily an injury or a problem. It's information your body is giving you about many things. You have this sensory organ that's your body that gives you information about the world around you. And sometimes we misinterpret some of that information as pain. We have very few words that can describe what we sense in our body. Our body feels, we sense those energies. We have very few words in any language, anywhere around the world, to speak about what the body is telling you. You tend to have the word pain, or maybe a problem, or I'm uncomfortable. So this can dramatically change how you are with pain. You can eliminate pain because you see it from a different point of view. You can open up and create space in this connective tissue of your body, the tissues of your body, you create more space. So it doesn't bind down on some sensitive structures like nerves and blood vessels. So that's going to decrease your body's dysfunction or dis-ease, and you'll have more of an ease or space of movement with that. So yes, as a physical therapist, obviously, musculoskeletal pain has been my primary population for some 30 years, nearly 30 years. So I'm well versed in that subject, and I can talk about it a lot and give a lot of people a really different way of looking at this, a different point of view that is beyond this reality's point of view about pain and dysfunction and dis-ease. I say dis-ease. It's like to have more ease with your body, giving it this a freedom and a space of movement by opening up any kinds of, we could call them adhesions or contractions in your body systems, will create more ease with your body if you desire that. Now, I can't create the ease, it's a choice. I can't get rid of your pain, I can't heal you, but I can give you tools. So if you would like that as part of your future, you can choose it, because your body has an innate, amazing capacity to heal itself. It's a generative organism and it's generating all the time. How would you like your future with your body to be? What would you like to create? How would you like your body? How would you like to sense your body? Would you like to feel beautiful energies or energies that are just uncomfortable or painful? Like, there is a different possibility. I have seen people, thousands of people, come out of pain, change their points of views about pain, just have no more pain. I am one of those bodies. I mean, years ago, I did have pain. I had 3 kids. I had some back stuff, got some of this fascial cranial sacral work, started doing access, and I really am pain-free. It's a very strange thing to have pain in my body. It's usually just, if I feel something that I would have described as pain years ago, it's just, oh, what is that? Body, what are you telling me? Is it mine? It could be that what's going on in the body in the next patient I see, or someone across the world, or many, many other things can be what the energies that my body's talking to me about. So like, what have you decided pain is that it is not? Is a question I have in this class that I love to ask, to start looking at pain from a different point of view. What else was in that question? Any questions about that? I'm just talking. Let's see. Oh, and people who are well. Well, what if you all are well? What if wellness is something that you all have available? Your point of view creates your reality. Your point of view creates your reality. What is your point of view? Your point of view is everything around you, the way you look at everything in the world. It's your history, it's your other lifetimes, it's your family, it's your culture, it's where you live on the planet. It's your point of view. It's how you see the world. So if you had a different point of view, would you have pains and problems in your life? And what if every problem in your life or your body is actually a possibility waiting to be explored? So yes, absolutely. I have many, many, many people come to this workshop who have no problems with their body. They're coming to have a greater body. Like you are where you are now. Your body is right here and right now with what's going on with it, what you're perceiving. Like, you can kind of just drop into it, check it out, increase the awareness of the space between the molecules of your body, and expand yourself out thousands of miles in all directions at the same time, and maintain that awareness of your body. And just check in. What are you perceiving? What are you sensing? What awareness do you have? What awareness is it giving you about the world around you? And that's you now. What would you like to have as your future with your body? What questions would you like to have? What choices would you like to have? Start asking those. You're here now. Your past is your past. You don't need to create your body from your past. It's generating all the time. You can create your body from today into a future that you create with it, not against it, not to it, but with it. That could be greater than you imagined. I know I did it. I'm doing it. I still do it. And thank you, Trace. I just saw, she said, I love the way you talk about bodies. Yes. Where else do we want to go with that? So yes, you don't have to have a problem to come to this class.
None.
You don't have to be a body worker. And was that ours, Pavel? Or was that?
Just switching between text and wrong button. It's okay.
It's okay. We'll just have
Okay.
2 videos. Was there, Bruno, did you have a question? You popped in for a second. Yeah? Yes.
Yeah,
Please,
there's a
Bruno.
question in the Spanish thread.
Okay.
This lady says, please, my son has this physical severe discapacity. How do you say? I don't know. And he's a joven oh my God, I am so afraid. He's
okay.
a professional, a young professional that loves the relationships with other people and contact with their bodies and hugging them. He loves his body. He looks at the mirror and he admires it. What can you say to me about these kind of bodies?
I'm a little confused by the question. So what does she say he has? Say it in Spanish.
He has a physical severe discapacity.
Nothing specific though. That just
nothing specific. Yeah.
He has a disability. I need to know a little bit more information. Like I mean, it sounds pretty amazing that he's looking in the mirror and liking his body, and he likes people. Like, how does it get better than that? Like, what else can he do? But I think I need to know a little bit more about the disability. And I have a lot of experience with disabilities too. I worked with disabled children for years back in Boston, Massachusetts, in the US, in the school districts for quite a few years before I started my own private practice that was more orthopedic. So if I can get a little bit more information, I might be able to give something to her. I'm not sure. Sorry about that. Hey, maybe she'll write in some more and you can pop in and let me know.
Yeah, if she writes it, I'll let you know. But
I can tell you about like most of the things, these disabilities or whatever, or abilities. I have seen people come to my classes with cerebral palsy, with extreme scars. If you, Bruno and Natalie were in a class I did in Ecuador this year, where there was a boy who had been burnt very young, at like a 1 or 2 year old, or maybe he was a little, but very young. He'd been burnt a huge majority of his body with skin grafts, and his changes and how much he could move and how his skin changed with this was extraordinary. Scars can be a really big place that we have contractions and limitations in the physical form of our body, and often we have trauma around those, so we have a little bit of PTSD. And you know, those of you who've done Access, trifold sequencing systems is an energy that can help with these things. So incredible changes can take place in those. And cerebral palsy is a population that I worked quite a bit with, and I've had some people with cerebral palsy come to this class who walked much better after, stood better. Just the whole relationship with their body started to change after the class. I mean, one of the things I speak to a lot is creating with your body. So energetic manual therapy is not a doing. Most of the body work that's out there on the planet, they do something to your body. You lay down on the table, you get a massage. You go to the chiropractor and he does this. You go to the doctor and he gives you pills, or the chiropractor or you know, the surgeon, and they cut you and they do a surgery on you. This is a creation with your bodies. Energetic manual therapy, which is the energetics of the body, this manual therapy that's targeting the body's connective, the shape, the organ of shape and form. You're working with the body. The body leads these sessions. And part of what I show you and speak to in the class is how you, as the body worker, the person gifting a session, can start to follow the energy of the body and let it guide you. I say often it's hands that dance with bodies. Now, if any of you guys are dancers, I don't know, I did dance quite a bit. If you are doing partner dancing, like a couple, which I'm terrible at because I cannot follow when you're dancing unless the person has impeccable rhythm, but otherwise I just lead, which makes me terrible to dance with. But if you are a follower, which is how we do EMT, we follow the body's lead. The body is always in charge, guiding the session. But if you are a follower, if you're really good, you also know where the body can go before it goes there, but you can't go until the body does. So if you're dancing with someone and you're the follower, you can't go until the person leading starts to take you there. So it's a creation with the body's and it's a body work for bodies. We're not doing stuff to the body. We're working with the body. And the beauty of this organ of shape and form, the connective tissue, the beauty of it is designed to resist forces that would deform it. Its whole purpose is to keep you looking the way you do. Without it, you know, my face would melt off and my liver would be down in my ankles. It keeps everything in place. And it is incredibly strong tissue. Your muscles, you can't stretch it. Your muscles can't change it. Otherwise, your muscles wouldn't work if they deformed it every time you lifted up a cup of coffee, right? So it has to change with a question and an invitation to a possibility that's greater. And the body has to be included in that. You cannot force change into the system. It is designed to resist it. It will fight you. If doctors will take out adhesions in bodies, they will do it with surgery. It sort of works, but then the body recreates almost something stronger where the surgery site was. So a couple of years later, these people come back and they have more adhesions. It's designed to resist. It's elastic and pliable, but it's also designed to resist forces. You cannot change it. You cannot, unless you're asking. It responds, and I love that. There's a video out there. It responds to a question. And I'd seen that video about when I started Access, and I was like, oh, I get why one of the things that I got that was so incredible by walking into my first Access class, having my bars run the first time, was this ability to be a question, and it expanded this work I'd been doing. So now it is truly like, it grew from the Access work. I'm saying a lot. Any questions about, are you guys all okay, my translators? I know some more questions came. Let me peek.
First of all, you're psychic because the diagnosis was cerebral paralysis.
Okay.
Yeah.
I am psychic.
Yeah, you're psychic. But there's another question.
Okay.
That if this can help with bodies that have been submitted to the drugs and alcohol. It doesn't say anymore.
Well, okay. So one thing is, I can't say for sure it's going to help anyone because that's your choice. That's the choice of the person receiving. But what I can speak to, what I can talk about, is that I have worked in drug rehab for people with chronic pain. I was a consultant, did physical therapy in rehab settings, and absolutely, I saw changes, incredible changes. I mean, if physical pain in their body is part of what's leading them to use drugs and alcohol, you get rid of the physical pain and often that'll change, especially if it's pain medication. I've had people just not need their medication anymore. They weren't addicted. They just had this pain. It was constant, and the only way they could cover it up enough to function was to be high on pain meds. When the pain was gone, the meds weren't valuable, unless they still wanted to get high, which is a choice for them to do. But they weren't choosing it from the place of, I'm in so much pain, I need to have this pain medication. So I've seen many people where their use of pain medication decreases. And possibly, there are other addictions. And now in Access, we have an entire body of work, Right Recovery for You, that Marilyn Bradford does. So people can look that up if they're interested. I'm sure that's in other languages. There's a book, Right Recovery for You, where they really look at some of the other things that are going on with addiction. Like it's usually an addiction to the wrongness of you or the wrongness of your body. Does that address the question, Bruno? Okay, yeah. And also there's the toxicity of your body. This reality has such weird points of views about toxicity and how it's so stuck and you can't get rid of it. But this fascial system, this organ of shape and form, also has this fluid substance, the gel substance, it's called gel substance, that if you're really bound down, getting the fluid flow through your body and the toxins out can be slowed down. So you can have, like, some of the things that I believe helped the people I was working with in rehab is I allowed their body to detox from their drug use with doing sessions on them. that was a contribution. I would also use some of the access body processes that's from the 3-day body class, which many of you have been to. So it's a combination. I mix up all of my tools of magic tricks, my cauldron of tricks, because Halloween's coming up. Bring them all to a session. And, you know, the work from Dr. Dain Heer, who I've studied with and taken classes for since his very first ESB. So all of that, if you have those backgrounds, you can use all of this in your sessions. This will be just another add to your toolbox, your cauldron of tricks and magic. Let's see, what else? What else? Question from the Czech Republic. I have arthritis in my thumbs. It is painful. How can I relieve the pain? Okay, arthritis. Arthritis is interesting because it's just a word that says your joint hurts, right? It's a Latin word. Arth is a joint and itis is swelling, pain, inflammation. Just means your joint hurts. So arthritis, did you say in her hands? My thumbs. Okay, so I don't know what kind. There's two different kinds of arthritis people show up. One is rheumatoid, which is an autoimmune. That kind of is, its point of creation is an autoimmune dysfunction, I guess, dis-ease. And then there's other that are osteoarthritis, which can be, point of creation can be overuse. Those are this reality's medical professional ways of looking at it. I look at it completely different. If the body is tightened up, if this system is hardened and it's more solid than it needs to be, and isn't this lightness of space bodies truly can float through the earth or walk upon the earth as they're floating, your joints get a little smushed. That smushed does probably not translate, huh? Is there a German or Czech word for smushed? They get tightened up, pushed together. Like if I had a shrink wrap or tight saran wrap pulling my finger down, my little joint, or it's her thumb, right, would get tightened together. And then the joint's not going to be as smooth. It's going to be too close. The ends are going to be too close. Your joints should never touch. They actually are suspended and floating in your body by this system of connective tissue. So yes, arthritis has changed with many people. We even had some video, I think it was in Colombia, Natalie was at that class, where there was a woman who had rheumatoid arthritis, that her mother had had it. There was some points of views about it being in the family that helped her create that. Her points of views that, oh gosh, I'm going to get it because grandma had it, contributed. But after this, working on it for maybe 5 or 10 minutes in a class, there was a noticeable difference in how she moved, but also the knuckles often can get bigger with arthritis, and they were smaller. It was pretty astounding. So yes, we can create changes. Remember, I don't heal bodies. I give you a possibility to access your body's own healing abilities, give you some tools you can use to work with the bodies, and how to listen to the body, not force the body, and create with the body for the changes it's asking for. If you give a body more than it can receive, or a person or anybody more than they can receive, it comes back at you. So if you force a system, it's not gonna, healing doesn't occur from force. Let's just say that. It has to be an invitation to the possibilities. And the access tools are incredible at giving you that access to what is possible. The name is Access Your Consciousness, and the body has a consciousness that you can access. And then your creations with your body become greater. Anything else? Any questions? I'm checking the chat to see if anything else showed up. Did I miss one? Oh, someone said, will I be having classes in the Bay Area where I live? I just had one like October 15th, so like 2 weeks ago. So probably not for a while, but yes, I will always do classes where I live. It's super simple and easy, no airplanes involved. So yeah, I would guess 6 months from now, I'll probably be looking at doing a class here, maybe sooner if there's enough people who desire it. I'll go, if there's enough people and you guys want me, I can jump on a plane and go almost anywhere. There's a couple countries I can't go to. There's some countries nobody's going to. I know there's a question I can feel.
Sí, qué cosita.
Oye,
¿Qué se ofrecía?
Ana, are you unmuted or do you have a question? Okay. I think that was Spanish, wasn't it?
I have another question in the Spanish chat.
Okay.
There's this lady with facial paralysis, and she asks, is that if her case is related to fascia or is it related to nerves?
Okay, so one of the things I don't do is look at the body as bits and pieces and parts. So the nerves and the fascia are interconnected and intertwined. The fascia is surrounded nerves. Every nerve cell has fascia inside it and outside it. It's the immediate environment of every cell in your body, and nerves are cells. So I don't really separate the two in the anatomical sense. Like, is it related to nerves? Is it related to fascia? You kind of can't, whatever's going on, it's got both going on. Facial paralysis is usually some of the facial nerves have had some kind of an injury, or it's often it's idiopathic, like you don't know how it starts. People's face starts to get paralyzed. It takes a nerve it grows at about 1 centimeter, an inch. So if you have a damaged nerve, it takes a few months for it to grow back. If it's a nerve that's not in your spinal column, what we call peripheral nerves, the medical lingo is not important for this. So if it was some kind of, like, the connective tissue was a little bit tight around those nerves, or there was some kind of a damage, yes, you could make some changes. With neuropathies or nerve problems, this work can be incredibly helpful. I've seen it be incredibly helpful with getting some of the sensations back, decreasing some of the pain, making the nerve less reactive. You know, one of the ones we work with as a physical therapist all the time is sciatica. Everyone knows that pretty much around the world. That hip nerve pain in your ass, pain in your butt. And this is, you know, this myofascial work is something that doctors will actually recommend and prescribe for people that have that kind of a nerve pain issue. So yes, of course. And what do you know? I mean, you're asking me, will it help? But what do you know? I mean, if you've already asked the questions, you already have an awareness it can help or can contribute or change something. Because unless you're asking for someone you know or someone you're working with, if it's your body, what do you know? What is your body asking for? And I just like to say that there's a lot of people now that have taken this class. So if anyone on here is looking for someone, I've had classes in Colombia and Ecuador and Germany and Switzerland, America, so mostly in the Bay Area. I know I'm blanking, Argentina. So there are people around the world that have taken this class, and you may, if you are looking for someone to do a session, Poland. Thank you. That popped into my head. Camilla just let me know that I did a big class in Poland back last year or earlier this year. So there's people around that know this work that if you were to, I guess, message me on Facebook or email me at drglenarice@gmail.com, I might be able to put you in touch with someone locally. We're not all over the world, but that's a target. What would it take for this to be the go-to fascial training on the planet? I mean, there's many, many people working with the fascial system. This is different in that it really includes the body in a different way. And it's using these tools of access, this being in the question with the body, that is unique, that really changed the work for me. I'm not sure what else to say. I think I covered a lot. So this was kind of a Zoom for the Czech Republic for my Prague class coming up. So Vendela or Pavel, do you have a question for me? I know Pavel is just smiling. He looks happy. Yeah. Is there something else? How about someone that's taken it, like a Natalie, or I think Teresa, you're on here too. Want to share anything? Oh, there's a good group of people.
Yeah, maybe what's popping, maybe you can share some story from your practice. I remember from your class the story about the girl with broken leg, with the bone separated, and this is, I think, very illustrative what can be done really with your work. I
Okay,
was
so
surprised.
yeah, I can. I just actually told someone that my aunt is in town, and her legs were twitching during she got a session, actually from my mother, who's 82, who's done my classes. So she was working on her younger sister, and her legs were twitching, and she was feeling like she thought it was really weird that her legs were starting to twitch and move on the table. And I was trying to let her have more ease with what her body was doing, and give her body permission to move and not try to stop it and be embarrassed by it. So I told her this story, which is interesting because my aunt has a very slight fracture in her pelvis. So I told her this story. So I had my neighbor actually is the young girl. She's now in her 20s. She was like 6 at the time. She's in college right now, away at the university. So she had broke her leg skiing, and it was later in the evening, and they put her in a splint, a temporary removable cast, drove back home. It's about a 3-hour drive from the ski area back to their house. And she had an appointment later in the following day to see the orthopedist. And they thought they were going to have to do pins and surgery on the bone. Now, this is EMT, but it's also the access body processes. I can't remember what I was using. So I went over, and she just had, I mean, it was brand new fracture. I wasn't going to do any manipulation. It was to stabilize that leg and let those ends of the bone start their healing process, getting the pieces back together. So she's in a cast, and I put my hand above her knee, above the cast, and by her tippy toes, because her toes were coming out of the cast. And as the energy started working, the energetics of energetic manual therapy, or the energetics of access body processes, I probably ran cellular memory. If anybody has taken the body class or foundation with access, they would be familiar with that, and whatever else I do. And her little toes started twitching. Can you see they were like twitching. She wasn't bothered. She was 6. She thought it was funny. They were twitch, 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 twitch for much of the session, very small little micro movements. And her mother took her into the appointment later, and they took the x-rays, and her bone had completely aligned and set itself. It had gone from being crooked to being perfectly aligned. And her mom sent me the video and wrote me, "Oh my gosh, you're miracles." They still see me, the whole family, after 20 years. So or probably 15 years ago. So what had happened is that her body, with the energies and this presence and giving her body permission to heal itself, this energy, this invitation I would be with the body, the little small movements of her toes, the muscles in her leg were slowly aligning her bones back together. So no surgery, no pins, no screws, just put her in a cast, and she walked away. And she did Irish dancing for years. She was really, it was an amazing healing experience for her. I don't heal the body. She was able to heal the body the way her body would like to do it, because nothing was in the way to stop that. Is it possible with horses, to use on horses? Is that from someone in the chat? Yeah, I have. Well, I mean, I was doing this similar. I mean, I was doing what I did when I was doing SE Extravaganza. The way the class was set up years ago was that I would teach the body part, and Susie would teach the horse part, and then it started to mesh up, and then Susie went on to teach. So we were working with horses, and I've worked on, mini horses. My horse, I have a horse in Costa Rica, and Gary's horses. I would work with Susie lots of mornings doing this. So yeah, if it's, I think at the beginning of this talk, I spoke to that if it's a body, an animal body, you can do this on them if they'll let you. Like I said, I've worked on hamsters. My daughter has had hamsters, and I did do some stuff with them. I've worked on my cats and dogs and horses. So absolutely. I don't know if you were about the whole technique or just the bone. A little different thing if a horse breaks his leg. It's pretty devastating for a horse. That would be something a vet would have to take care of. But the healing, if a horse is, I've seen horses injured, and this did wonders, magic. Because the horses really don't have a point of view, and if you offer them the possibility of creating something greater, they just choose it. They don't think it's not real. They're just like, wow. I did have a horse story. Do we want another story?
Got some stories, Glenna.
What? You have a story?
I've got stories. Yeah. I mean, I've got lots of stories because I've been in so many of your classes, like Natalie, and they bring me so much joy, even tapping into the energy of everybody's questions tonight and everything that you've been talking about. It's like, it makes me so excited. It's better than Christmas. And I'm wearing my Rudolph pajamas and it's still better than Christmas. But I mean, stories of seeing things that you've done with bodies, like when we were in Poland last time and you did a taster session, you did an arm pull on a guy that had had major surgery, not being able to move his arm. His point of view was totally what the doctors had told him. He wouldn't be able to have full rotation of movement or anything with it. And you worked on him during a taster and he got full movement back. It was amazing to see. But then also, like, things that I've seen so many things in class, but from my own personal experience of using EMT, similar to the two stories that you just told. I've got a son who's very good with his fists. He shows his emotion by punching walls. And we ended up in hospital one day and they were telling me how he was going to have major surgery. Is like, they hadn't even x-rayed it or anything, but his hand was huge. And I just put both of my hands on his hand, asking for the EMT and what was required with the fascial system. And when they eventually took him down, they were like, we don't need to do anything. And within the space of about 2 hours while we were waiting, it completely changed. So they then gave him a splint to wear and told him that he'd have to have it on for 6 weeks. And 10 days later, he stopped wearing it. Yeah. I mean, he changed a lot.
It's amazing what bodies are actually capable of when we get out of their way.
Mm-hmm.
I mean, that's really what this is. If we get out of the way and let them heal, it appears to be miracles. But what if it's not what if miracles were our new normal? You know, like that's where we start from. There's a couple questions in the chat that I saw, and then see, is it possible to do SE and EMT together? Absolutely. I know that SE is an energy, that it's a name Gary gave Susie for the energy she does, which is why it's so beautiful. She's out there creating this on the planet. And you can turn that on. If you've taken her class, she gives you that, you're aware of that energy. You can turn it on. There's, everything you've ever been or done, you can use to create your future. Don't throw anything out. Add it together, use it when, if you're following the energy and being aware and being a question, you'll know what the modality you have. I mean, the food, the nutrition, what the body's asking for, the exercise that the body's asking for, you'll know. What if you could know, what if knowing was so much easier than you ever imagined? But yes, for a long time I think Essie just ran because I taught the class for so long. What I ask for is whatever energies I have available, and I'll speak to this in class, that I have uniquely available to run and contribute to the bodies. And then those people that come to my classes, I ask that you ask that same question, like every body has abilities and talents that are unique to yours that can contribute to other bodies. Magic is the future science. I like that from Julia. Yes, magic's the future science. Yeah, there was one story that I think I'll say about horses because that came up. I was working on a horse in Costa Rica. Was it during the extravaganza or maybe after? But anyway, the horse had a big scar. Had been poked by a branch and stabbed it himself kind of by its ribs and had a really painful scar. It was healed up at this point. It'd been a while, maybe a year since it happened. And what the horse would do is when you went to tighten up the saddle, it would take a big breath. So you couldn't, and then they tighten it up as much as they could, and then the horse would exhale and the saddle would be loose. And they could not get the horse to stop doing this. Every time they put the saddle on the horse, they'd go to buckle it up really tight, and the horse would take a big breath and expand everything out so they couldn't get it tight because it didn't want the saddle tight on this old scar. So I was working on the scar. I'd heard the story, and the scar was just twitchy, and the horse moved away and didn't like me touching it. So I kind of worked around the outside of the scar, working on the scar. It came in more and closer, really slowly, letting the horse guide me. Because if I forced it on the horse would walk away, twitch away, just like it did with the saddle. And finally could get actually working directly onto the scar. Did some of this, the fascial release work, myofascial release, EMT, SE, whatever. I was working with my hands around the scar to give it more space so it wasn't tight, which would reduce some of the discomfort the horse had. And the next day they're like, yeah, we can saddle the horse up now. You didn't do that trick. You could saddle him right up, nice and tight, so his rider, friend of mine, could ride the horse safely with the saddle on. So yeah, animals actually can be easier than us because they don't have a point of view, and they let you know if they don't like it, and they let you know when it works a lot easier sometimes than human bodies do with our points of views. Cool. I think we've been on for almost an hour chatting away. Oh, I'll do this last question. I think this is the last one, unless someone has a good one out loud. So is it possible to completely remove growths on the spine? Well, anything is possible. So like I said, these kind of questions, it's like, I can't promise. I've seen stuff change. One of the things that happens when the connective tissue in the body gets really dense and tightens, it goes from a loose tissue to a more solid tissue to an adhesion, and then they can calcify. And when you open it up and loosen it up, in theory, and what I've seen is, yeah, the calcification can go away. So like bone spurs in feet, I've seen reduced. And you have to be aware of that your bones are living generative tissue. They aren't as solid as you think they are. They're like a fascial tissue with bone cells and calcium in there that make them pretty strong and solid, but they are flexible in a living body. We usually see them, we don't usually play with them in bodies that are living. Their bodies wouldn't like that very much, but they do have a flexibility, and they are remodeling continuously. And about every 3 months, most of the bone you have now will no longer be there. They will be all new. So your bone's about a 3-month-old baby all the time. That's why if you break a bone, it takes about 6 to 8 weeks to heal it, because it's constantly generating and remodeling itself based on the function you require of it, what you're doing. If you don't use it, the bone can become less dense. If you use it a lot more, it becomes stronger. If you put on muscle strength, the areas that the tendons attached to the bone become more dense to deal with the abilities you have, functional, how you move around the world. It responds continuously. So bone spurs are bone. In 3 months, you're just going to grow a whole new bone spur. I mean, it's not that linear, but the cells are always remodeling. So would it be possible? What do you know? Could you allow that area of your body to not be as solid, so solid that it has to calcify in an area that the body does not require it? So yes, if I can take some of this tension off of some of the ligaments and pulling in the spine or in a foot or something, that the bones can change. Often people are in quite a lot of pain and aren't going to be seeing me a lot for in the more severe cases of that. And they've been told, which Teresa talked about, they've been told that it's not changeable, which is one of the hardest things that's one of the most difficult points of views that can kind of hit you when you're working with bodies, is this point of view that the medical profession may have, or other practitioners, that it's not changeable, is a tricky one to get around, but it's possible. People do change their points of views, and then you see magic show up. I've seen bone spurs go down, at least, or pain go away, and they were never x-rayed again. So I have no idea if the bone spur's gone or the spurs in their back, those bony things, are gone. I have no idea, because they didn't hurt anymore and no one ever took another x-ray. If you're pain-free, you don't go to the doctor. Cool. A last question from anyone or comment? I think this kind of heading down. Yeah. It's getting later there in Europe. You guys just set your clocks back today too, right? Does it fall back, fall forward, whatever, your different time than it was yesterday for you guys? Okay, if there's no more questions, you can go to accessconsciousness.com/Dr. Glenna Rice to find the list of all my classes and where they're at. And you can message me on social media, chat apps pretty easily, or email me at drglennarice@gmail.com. Am I coming to Ecuador soon? Well, I don't know, Natalie. Am I coming to Ecuador soon? Or Bruno? Yes, I love Ecuador. I'd come there. I was there, how long? We were there this summer. And a wonderful
Yes, Glenna doesn't know, but she's coming the next year to Ecuador again. But she doesn't know yet.
I don't know when I'm coming back to Ecuador. But yes, Natalie is usually hosting me there, and she lives in Germany the other part of the time. So I can come without Natalie, but I would hate that. Yeah. Okay. So we'll put some links in here. We'll get this posted up on social media so you can share it around with people. And I have to thank my beautiful, beautiful hosts in Prague for setting this up. Vendela, you're amazing. You're absolutely amazing putting this together. I think we added a language half an hour before we started. Bruno was like, can I come on and do Spanish? I'm like, let's do it. So this was created so organically and with such ease. So thank you. And Pavel for being the tech guy extraordinaire. I'm very happy with that. And Bruno and Natalie and Camilla and Vendela for doing my translation for this. Everyone will be very happy to get this in other languages. And I will see everyone somewhere on the planet, hopefully. What would it take now that we can travel? It's still new after a year, the 2 years of not traveling. It's still such a treat to get out and about on the planet. Thank you so much, everyone.
Thank you.
Thank you.
Thank you, Glenna. Thank you.
Who
Yeah,
else
looking
will be
forward.
joining us the last weekend in November for this amazing class?
Yes,
In Prague. In Prague.
that's my next one. Yeah, I can't wait to come back to Prague.
Yeah.
Right after Maestro, so who am I going to be?
Těsně po
Going
majstru
from
v
Maestro
Praze.
to Prague. Okay, thanks everyone.
Thanks.
Thank you.